Hello, my name's Jing Lee, and today we're going to talk about Margaret's case. Margaret is a 32-year-old woman who came to counseling through referral from her primary care doctor, who referred her for generalized anxiety disorder. And Margaret described herself as sensitive and emotional, and she has previous knowledge about CBT, and so she's hoping that the therapy will help her out. And Margaret's anxiety started about a year ago, and it seems like it's triggered usually when she's out shopping. And it started suddenly, and she began to feel anxious, nervous, and panicky. This feeling disappeared after a few minutes, but the same thing happened 2 weeks later, but worse. So her symptoms were a rapid heart rate, and she felt like she was going to pass out. Ever since then, it's been an effort to go out, so some days she decided rather to stay inside and not risk it. Since then, she's been feeling quite dreadful, often bursting into tears for no reason. And whenever she has these anxious panic attacks in public places, she feels really embarrassed. There, in the scene, as well as talking about it to the therapist. And the most recent case was a week ago, again in the shopping mall, where she began to feel breathless and nauseous. She thought it was embarrassing, and everybody was looking at her thinking that she was stupid. She felt this pain in her chest, which she thought was a heart attack, but she remembered reading about panic attacks, and so she talked herself out of panicking, but it only worked for a short time. So instead of staying in the shop, she left the shop and came back after 10 minutes after she's calmed down, after she calmed down a bit. And Margaret was brave. She wants to get better. She's searching for ways to get better, as you can see from her self help guides. Margaret felt very proud that she was able to control herself in that way, and she could do that because she read it from a self-help guide on the internet, which means that she's actively trying to get better. Although she states that it was her first time doing something like that, she challenged herself to break the pattern instead of avoiding the problem. So, Margaret decided to tackle the problem and face it instead of running away from the way she normally does. With the given information, I think her diagnosis would be social anxiety disorder, because her exposure to trigger leads to anxiety about being humiliated or embarrassed, or being embarrassed socially. She has persistent, intense fear and avoidance of social situations like shopping, and she fears negative evaluation. And we can see that when she says, "That's me, stupid. They think I'm stupid, or it's embarrassing, etc." Exposure to trigger also leads to like we already mentioned, thoughts about her feeling humiliated or embarrassed socially. And 33% of people who are usually diagnosed with social anxiety disorder are also diagnosed with avoidant personality disorder. And you can see she's trying to sort of like avoid the situation sometimes by not going out, although she has already broken a pattern, which is also a good thing. So we can see that Margaret has high potential of getting better, and she also pays more attention to the internal cues rather than the external social cues. The behavioral factors might include conditioning of social anxiety disorder. So Margaret could have had a negative social experience, whether directly or through modeling or through verbal instruction, whatever, in the past, and she's become classically conditioned to fear similar situations, which have been maintained through this operant conditioning, where her avoidance of behavior would reduce fear, and this would keep reinforcing her behavior to avoid things. And this means that there are few opportunities for the conditioned fear to be extinguished, because the person would tend to avoid the situation. The cognitive factors in the ideology might include unrealistic negative beliefs about consequences of behaviors, excessive attention to internal cues, as we already mentioned, fear of negative evaluation by others, and negative self-evaluation. And so yeah, and I didn't think it was really panic attacks, because she isn't really misinterpreting her somatic changes as impending doom, etc. Although sometimes she does feel like she's having a heart attack, but she gets worried about it, but she's able to pull herself out of it, so it didn't seem too serious. And I didn't think it was agoraphobia, since her main fear is not about being able to escape or find help, but it's more around how other people think of her. And I didn't think it was GAD. Well, I was leaning away from GAD because her worry is mostly regarding negative emotions and images, instead of having negative emotions and images being like a distraction. She doesn't really have previous trauma. Well, not that we know of yet. But since she was referred as a GAD, I would ask further questions of what she's worried about, and if she has to do, and if it has to do with fear of unfamiliar people or social scrutiny, then I would more likely to rule out GAD. And the treatment would be to have her focus not on the internal cues, and maybe increasing exposure to the situation. So maybe we could do like a role play between the therapist and the client, or even like a group session. Group role playing might not be bad, and perhaps prolong the exposure to the shopping mall. See how she does. If she does have a panic attack, tell her what she needs to do. Explain to her about her situation, what she might go through, why she might be going through this situation. And with prolonged exposure, maybe this anxiety would be extinguished. Maybe also she could be taught to stop using her safety behaviors, whatever they may be, in avoiding this situation. Like, for example, if it was just avoiding the situation, have her go to the place a bit more. And maybe we could also help, as we mentioned before, to help her focus to not focus their attention internally. And maybe the therapist can help by helping the client combat the negative images of how others will react to Margaret. And this cognitive therapy seems to be very useful, and I think Margaret also needs more encouraging in telling her that she's been really brave. She's already broke the pattern. She's able to break the pattern, and give her hope and strength in ways of encouragement. Yes, thank you very much.